Hi, welcome to this presentation on our signature assignment for ATR 700B, Evidence-Based Practice 2 at Fresno Pacific University. So our assignment is titled Patient Rated Outcome Measures. So I'm going to try to provide you an overview of our assignment, hit the highlights, the things that I hope that will help you with this assignment. So I want this assignment to be something that you're actually doing at your work. So think of a clinical case, a patient that you actually are working with, or a group of patients if you have more than just one patient that you are seeing a lot of ankle sprains or knee injuries or whatever it may be. Something that you are actually working with in your clinic. Now, I will allow students to do this as a group project, but you have to still be using the same patient-rated outcome measure PROM with this. You have to have patients that are, similar, college-aged or high school-aged, those type of things. Then you can do all this. Okay, so in your paper, you're going to describe the clinical case. Now, I've provided you a completed assignment from the last class that this was taught. I made a couple changes to the assignment where I want this to be more a reflection on using the PROM. In the previous class, we didn't have the students actually use the PROM over several weeks. You'll see in our class that for about 3 to maybe 4 weeks, I want you to actually use the PROM on your patient or patients. So you can see what it's like to use it. In your summary of your paper, you're going to discuss how to go with using this PROM over a couple weeks. Okay, so in your paper, your initial paper, you're going to provide a clinical case. Tell us about your patient or patients, what's their injury history, their current status, all those type of things. Include the PROM that you've selected for this clinical case and provide a brief description of that PROM, its purpose, and how to use it. We're going to go more detail of that, so it just needs to be a summary of your PROM. What's the name? It's a 12-item closed-ended scale that was designed to do this, blah, 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 and you give it to them, and it's a brief description of how you use it. Again, you're going to pick just one. You can choose whatever patient-rated measure, outcome measure that you want to use that be appropriate for your clinical case, your patient or patients. I want you to include a copy of the PROM in the appendix or provide a link to the PROM. Sometimes it's really difficult to get the PDF version of the PROM in the appendix, so you can provide a link. You'll see in the example paper that I provided you, there's a link to it, to the PROM. Okay, so again, you're going to use your PROM on your patients for several weeks, and I tell you in class when you need to stop using it. So I think you'll start in week 2-ish once you pick it, and then I think we have you stop it around week 6. And then from week 2 on, you need to start doing your literature review. 5 peer review articles is really not going to be that much. You're probably going to need more than that. There are probably going to be more articles related to that PROM that you're using, because you're going to address 9 main areas about this PROM. So you're going to become an expert in this particular PROM by doing this lit review of this particular measure. So you'll see that in week 2 that I've provided a link to the University of Oxford's selection criteria article in our textbook. There is a whole chapter about this, and we're going to address each one of these in your paper. Instrument development, validity, responsiveness, reliability, appropriateness, precision, interpretability, acceptability, and feasibility. So I'm going to briefly go over these. With instrument development, what was the process that was used to develop this instrument? So you're going to describe that in pretty much detail. It'll probably be some of these sections will be 1 to 3 paragraphs. Some of these sections will be a page or 2. So it just depends on how much information there is on each one of these sections. The next part, you're going to talk about validity. What makes an instrument valid? Validity has to do with is it actually measuring what it's supposed to measure. That's what validity means. You're going to address the different types of validity. Face validity. So just looking at it, does it seem valid? Is the content within the instrument, is it valid? Did they construct it correctly? And the criterion validity. We talked about this. If you've taken research methods, this was discussed. We talked about this a little bit in our first evidence-based practice class. You'll learn more about this now. Responsiveness. How effective is it? We'll talk about the minimal clinically important difference in the scores. Has that been established? What's it mean when we have a difference in scores? What level do we have to get to say that there has been a change for the patient based on this particular PROM? Again, with all these sections in your paper, you want to cite references to support your information. Reliability is, can I do it and you do it, and will we get the same scores? And so we'll address that. The research that you're using should address this. You'll just report what they have found. And a lot of these you're just reporting what you have found in a research. Is this particular PROM appropriate for your clinical case, and why you selected it over the other options that there might be out there? What was the main reason why you picked that particular PROM over all the different other ones that may be out there? Maybe that was the only one that was there. Describe the situation, your patients you encountered in your clinical setting for whom this PROM may not be appropriate. So this is the applicability here. Is it appropriate for your setting, and why or why not? How precise was that scale that you used? Was it ideal? Why or why not? What made it helpful? What did not make it helpful? Again, some of these sections are going to be longer. Some of these sections are going to be shorter. Interpretability. Now we're going to go into discuss how the MCID for this PROM can assist you interpreting the instrument. So after you've been doing this for a while, you get the results. How's this helping you in your clinical practice? What's the word I'm looking for? How difficult was it to interpret the data? And was there a big spread in that MCID, or was it very narrow that made it pretty difficult for you to interpret what the results of this instrument was about? Acceptability. How long did it take to do the PROM with your patients? Did your patients do it? Or did they care about it? Did they get bored with it? Were the questions understandable to your patients, especially for your population? Like if you're dealing with high school kids, maybe they didn't understand it. Were the patients comfortable with asking any questions? Why or why not? So This is where you're going to have to pay attention to while you're giving out the PROM over the weeks, and ask those questions to your patients, and keep a diary of this so you remember this down the road. Feasibility is how expensive it is. Is it really, and your time, not only financially on the money side of things, but your time. You're all busy in your clinic, or whatever clinic that may be. Are you willing and able to devote the time it takes for patients to complete this problem and to do the back end stuff, figuring out the what's it mean with the PROM? May not be that big of a deal if you're only doing this with one patient. What if you're doing a whole team, or you got a whole bunch of patients that you're dealing with this? Is it really worth your time? How much time did it take you to score it? How often will the PROM be administered? What resources could you take advantage to make this process more feasible? Because some of these PROMs have online tools that you may be able to use. Use an iPad or the iPhone, or whatever phone that you may have with the different apps. So look into that too. Now, the conclusion and summary section is the most important part of this paper, because what I want you to do is summarize your findings of what you learned about this, especially from using the PROM over several weeks. What are the strengths of this PROM? What's the weaknesses of this PROM for your clinical practice? Now, if you're doing this with a partner, you both need to address this in your paper. Again, how does this help you? How does this not help you? What additional steps need to be taken to establish any of the 9 criteria? Again, relate all this information back to your specific clinical case, your practice, and application. I want this to be personal applications. This is one of the areas that I've changed and added in this assignment. I want it to be more practical to you. What did you learn about this particular PROM? How can you apply it? What's good with it? What's not so good? How can this affect your clinical practice? So this is really the personal application section, is your conclusion and summary. Formatting stuff. Here I've provided you a template in the class, so just use the template I provided, and I have the sections that you'll need. I pretty much copied and pasted the directions in each section. Please remove the directions and include your information. Again, I've provided you a completed assignment so you can kind of see what another student wrote. And there's the information there. I've provided you the directions and just a template to get rid of the issues with formatting, since I can be kind of strict about that. Go back to our syllabus. Just so you know, you have a rubric here that I'm going to use to score you on, so you should always pay attention to the rubric and how I will score you. Now, the other thing that you're going to do with this assignment is you're going to, after you write your paper, you're going to do a presentation on the highlights of this particular assignment. You can do any kind of, you can use an audio PowerPoint. In some of our classes, we've gone over the, I'm sure I'm saying it wrong, the Kucha type presentation. But I want you to do a presentation where you're providing the summary of these. So I would assume that you will have one slide for each one of these main sections of the 9. But most of the time, I really want you to spend here in your summaries and conclusions. Obviously, you're going to describe your clinical case, what PROM you selected and why you picked that one, and then address each one of these, and then spend a lot of your time in this conclusions and summary to help your fellow athletic trainers learn about that particular PROM, because they may want to be interested in that. Maybe you picked one that's interesting to them, and they want to use that particular PROM in their clinical practice. Well, now they learn about it and they have that. So in your forum post, make sure that you provide either the actual copy of the patient-rated outcome measure, so they have a copy of that, or a link to it, just like we've done in a paper. So they don't have to go find it, and you've provided that for them. And we'll have a discussion with that, as we typically do, as you can see in the directions in the form. If you got questions, please ask. This week, what I'm asking you to do is to pick your PROM. So you have to do some research this week to find the PROM that you want to use. And also, if you're going to do this in a group, 1 or 2, or obviously 1 or 2. If you're going to do it, 3 would be max. And again, you have to have really close related clinical scenario where that you can do this on the same kind of patients through the class. So if you're going to work with somebody else, please post that. Tell me what PROM you're going to do. I want to limit it to first come, first serve. But if we have issues with that, we can talk about that in our form. I will approve your PROM that you pick in the form. If you have any other further questions, please ask.